Hello everyone. You are watching me, Zahur Islam official. Today my presentation topic is the role of hospital pharmacist and clinical pharmacist. So how we can differentiate the hospital pharmacist with clinical pharmacist? The services including clinical pharmacy and clinical pharmacist, patients get right care from all the facets. All the drugs related problem can be easily be eliminated. Physician and other healthcare professionals get more focused in their own workload to them is low. The patient feel more comfortable. So you know that every drug is every drug is poison. It's the dose that differentiate poison or the drug that substance is. So if you remember that we should start from low dose, and with the passage of time the dose should be increases. So every drug is poisons. If it is taken, if the medicine they are taken in a small quantity, so it become poisons, in a large quantity, so it become poison. So if the drugs they are taken are poison, if the poison they are taken in a small quantity, so it become medicines. To kill ill by pill, not by bills. The last person to be involved in healthcare team with the patient, the pharmacist, so the system has to rely upon him or her. The services without clinical pharmacy and clinical pharmacists, due to high load to physicians and other healthcare professionals, the quality of the patient care will be low. Most of the drug related problems cannot be easily eliminated, and the patient may not feel comfortable. Especially in developing countries like Nepal, the physicians are incompetent, nurses are careless, and pharmacists don't know anything. So system is corrupted, public is foolish, and patient load is high. Medicine is for those who need them, not for those who want them. If your medicine is not working, so it may not be your medicines, it may be you. So you can kill the number of populations with the help of single drug. Medicines are dangerous if they are said to be taken in a large quantity. Okay, so let's come toward pharmaceutical care. So pharmaceutical care, it is a practice in which a practitioner takes responsibility for the patient drugs related needs and holds him or herself accountable for meeting these needs. So it describes the specific services and activities through which an individual pharmacist cooperates with the patient and other healthcare professionals in designing, implementing, and monitoring a therapeutic plan that will produce specific outcomes for the patient. Wherein the pharmacist is engaged in drug monitoring, disease monitoring, drug therapy, and disease management collaborative practice. Pharmaceutical care is the component of pharmacy practice which entails the direct interaction of the pharmacist with the patient for the purpose of caring for that patient's drug related needs. What are the goals of the pharmaceutical care? The main goals of pharmaceutical care is to optimize the patient health related quality of life and achieve the positive clinical outcomes within realistic economic expenditures. So that the pharmacist is also responsible for the pharmaceutical care, and he or she should improve and optimize the quality of the life of the patient and to achieve their own positive clinical outcome. The target which you want to achieve, that is within realistic economical expenditures. What are the essential components of the pharmaceutical care? So the essential components of pharmaceutical care is pharmacist-patient relationship. Pharmacist-patient relationship, this is collaborative effort between pharmacist and patients. The patient's workup of drug therapy, provision of pharmaceutical care is centered around this, although the method is used for this purpose may vary, and components are: the first one is data collections. We should collect, synthesize and interpret the relevant information, the patient demographic data, age, sex, race, etc., and the pertinent medical informations. Medical history, the current and past family history should be noted there. Dietary history, medical history, prescription, OTC or the counter drugs, allergies and physical findings like weight, height and blood pressure measurements. Lab results, the serum drug levels, potassium level and serum creatinine level relevant, it should be checked to the mean drug therapy. Patient complaints, the signs, symptoms, it should be also investigate. The second one is to develop or identify the core pharmacotherapy plans. So core means the condition or the patient need. So O mean the outcome desired for that conditions. R mean regime selected to achieve that outcome, and E is the evaluation parameter to assess the outcome achievements. The third one is to identify the prime pharmacotherapy problems. This includes the pharmacist interventions. The goal is to identify the actual or potential problems that could comprise the desired patient outcome. So prime mean the pharmaceutical based problems, risk to the patient, interaction, mismatch between medication and condition or patient needs. E mean efficacy. Documentation of pharmaceutical care. So we should formulate a form note or soft note to describe or document the interventions needed provided by the pharmacist. Form progress note is actually the description and documentation of the intervention intended or provided by the pharmacist. It means the findings, patient-specific information, gives basis for recognition of pharmacotherapy problems or indication for pharmacist interventions. I mean assessment, the pharmacist evaluation of the finding including the statement of any additional informations needed to best assess the problem to make recommendation. The severity, the priority and urgency of the problem, the short and long term goals of intervention proposed. The short-term goals are elimination of the symptoms, lowering of blood pressure, management of acute asthma without required hospitalization. And long-term goals, we should prevent the recurrence of a disease, control blood pressure, and prevent the progression of the diabetes. Or mean resolution including preventions, so observing and reassessing, counseling or educating the patient and caregiver, informing the prescriber in making the recommendation to prescriber, withholding medication or advising against used. So M means to monitor or to assess the efficacy, safety and outcome of the intervention, and this should include the parameter to be followed: pain, depressed mood and serum levels. The intent of monitoring, for example, efficacy, toxicity and adverse events, how the parameters will be monitored, for example, interview patients, serums, drug level, and physical examination. Frequency of monitoring: weekly or monthly. Duration of monitoring: and until resolved while in antibiotic, then monthly for 1 year. Anticipated or desired finding: no pain, healing of lesions. Decision point to alter therapy when or if outcome is not achieved. For example, the pain still present after 3 days, mild hypoglycemia more than 2 or a week. So this is usually primarily by the physician. S mean subjective findings, O mean objective findings, A mean assessment, and P mean plans. Okay, so now come toward the clinical skills and the pharmacist role in pharmaceutical cares. So the role of the clinical pharmacist is patient assessment. Patient assessment include physical assessment, barriers to adherence, and psychosocial issues. Education and counseling: this is also the major responsibility of the clinical pharmacist, who is entered with the skills, communication skills like empathy, listening, speaking, and writing at the patient level of understandings. And he has the ability to motivate and inspire the others patient, develop and implement the patient education plan based on an initial education assessment, identification and resolution of the compliance barriers. Patient-specific pharmacist care plans: you should recognize or recognitions the prevention and management of drug interaction, pharmacology and therapeutics, interpretation of the lab test, the knowledge of the community resources, professional referrals, communications, and support with community medical providers. And drug treatment protocols: we should develop and maintain the update protocol like follow-up protocols as a pharmacist, as a clinicians, to monitor and aggregate adherence to the treatment protocols like the drug utilization evaluations, especially for the managed care or health system facility. Dosage adjustment: so you should also identify the patient at high risk for exaggerated or subtherapeutic response. Apply the pharmacokinetic principle to determine the patient-specific dosing. Prescriptive authority to the pharmacist, so as it is also designated to the clinical pharmacist to practice the site and position. Okay, so what is the aim, or what are the aims of the pharmaceutical care? So first of all, you should know about the effective drug therapy, improve the quality of life, and safe drug therapy and economic drug therapy. An effective drug therapy: will the patient take the therapy, and what does the patient view and improve the quality of life. So that was all about the clinical pharmacist. So thank you so much for watching my lecture.